She walked through those sliding doors carrying a single bag and a name tag that said, "Nurse." Nobody looked twice, nobody asked where she'd been. And the man in charge laughed, actually laughed, in front of 20 people, pointed at her and said, "You're just a nurse, stay out of my ER." Claire Bennett said nothing. She picked up her badge, clipped it to her chest, and went to work. What nobody in that building knew, not the chief physician, not the charge nurse, not a single administrator, was that Claire Bennett had pulled men out of burning vehicles in Kandahar province while under active fire. She hadn't come to Riverside Memorial to impress anyone. She'd come because something in that hospital was already very wrong. Then a military helicopter landed in the parking lot and everything changed. Before we go any further, if this story already has your attention, drop a comment below with the city you're watching from. I want to see how far this one travels. Hit like, follow the channel, and stay with me all the way to the end. You don't want to miss what happens next. The drive into Ashford took Claire 40 minutes from the motel off Route 9 where she'd been staying for the past week. She didn't have an apartment yet. She'd been eating gas station sandwiches and reviewing the hospital's publicly available inspection records on her laptop at a plastic table near the window. 3 citations in 2 years. 2 settled malpractice claims with sealed outcomes. A mortality review flagged by the state health board that somehow resulted in 0 disciplinary action. She'd circled those entries in red and taped the printout to the wall above the bed. She wasn't paranoid. She was methodical. There was a difference, and the Army had spent 4 years sharpening it in her. Riverside Memorial Hospital sat at the edge of Ashford's old industrial district, a 12-story structure with a newer wing bolted onto its east side like an afterthought. The parking lot was already half full at 6:40 in the morning when she pulled in. She sat in the car for a moment, drinking the last of her coffee, watching a pair of orderlies wheel a supply cart through the ambulance bay. The bay doors were propped open. Inside, she could see a stretcher with a crumpled paper sheet and a crash cart pushed against the near wall. She got out, shouldered her bag, and walked in. The emergency department at Riverside Memorial smelled like antiseptic and old coffee, and the particular exhausted tension of a night shift that hadn't fully released. Claire checked in at the nursing station, received her badge and orientation packet from a woman named Dora, who spoke without looking up from her screen, and was pointed toward the charge nurse's office. The charge nurse was a compact woman in her 50s named Patricia Holt, who had the look of someone who had seen every variety of problem this department could generate and had stopped being surprised by any of them roughly 15 years ago. She reviewed Claire's file with the same expression she probably used for scheduling conflicts and broken IV pumps. "You've got a gap," Patricia said. She tapped the paper. 14 months, before the travel nursing contracts. "Personal leave," Claire said. Patricia looked up. She had gray eyes and the habit of keeping very still when she was deciding something. "You don't look like the personal leave type." "I needed some time." Patricia held the look for another beat, then went back to the paper. "You're assigned to Trauma Bay 2 as primary support. Doctor Harlan Voss runs the ER. His word is final in this department. He has," she paused, "opinions about the scope of nursing practice. You'll figure that out fast enough." "I'll manage." "Everyone says that." Patricia set the file down and stood. "Come on, I'll walk you through." Harlan Voss was already in the department when Patricia brought Claire through the main corridor. He was standing at the central station reviewing a chart, still in his coat, a tall man somewhere in his mid-50s with the kind of silver-haired authority that photographs well and intimidates easily. He was broad-shouldered, wore his stethoscope like a piece of jewelry, and was performing, really, to a cluster of residents who were nodding at intervals with the careful attention of people who understood that nodding was professionally safer than questioning. Patricia touched Claire's arm. "Dr. Voss, this is Claire Bennett, new trauma support starting today." Voss turned. He took in Claire the way some men take in a room, cataloging it, categorizing it, deciding quickly where things rank. His eyes moved from her face to her badge to the file folder Patricia carried and back to her face. Then he smiled. It was a specific kind of smile, the kind that signals to everyone watching that something slightly unkind is about to be said in a tone that will make it difficult to object to. "A nurse," he said. Not a question. An observation presented as mild amusement. "That's right," Claire said. "How long have you been in emergency medicine?" Long enough. One of the residents shifted his weight. Someone near the medication station suddenly found a reason to study their clipboard. Voss tilted his head. We run a tight department here, Ms. He glanced at her badge. Bennett. Protocols exist for a reason. Nurses support physicians. They do not make clinical decisions. They do not initiate treatment, and they absolutely do not. He let the pause do its work. Interfere in my ER. Are we clear? Claire looked at him steadily. I'm here to do my job. Good. He turned back to the residents as if she'd already stopped existing. As I was saying, the revised sepsis protocol, Patricia steered Claire away by the elbow, not roughly, but purposefully. They were 6 feet down the corridor before she spoke. I told you, Patricia said quietly. You did, Claire agreed. Don't take it personally. He does that with every new nurse. He did it with me in 1987, and I've outlasted 3 department restructurings, so... Claire almost smiled. Noted. Her first 3 hours were quiet by ER standards. 2 chest pains, one of which turned out to be anxiety. 1 confirmed STEMI that was transferred upstairs before she finished her intake paperwork. A laceration repair. An elderly woman with a compression fracture who waited 4 hours and was polite about it in a way that made Claire feel worse than if she'd complained. Claire worked clean and fast, documented precisely, stayed out of the way of the attending physicians and out of the sight line of Voss. She was not hiding, she was observing. There was a rhythm to a department that told you things if you paid attention, how the staff moved, where they slowed down, which physicians the nurses deferred to and which ones they quietly worked around. At Riverside Memorial, she noticed within an hour that 2 of the attending physicians, a younger woman named Dr. Reyes and an older man named Dr. Kamau, were good. They were the ones the nurses flagged first when something complicated rolled in. Voss, she noticed, was more often at the station than at the bedside during busy periods. The residents near him were competent but nervous in the specific way of people who had learned that being right at the wrong moment was more dangerous than being quiet. She filed all of it away. At 11:45, an ambulance brought in a construction worker named Dale Pruitt, 48, who had taken a beam to the chest at a site 2 miles east. He was conscious but poorly, with diminished breath sounds on the left and a blood pressure trending down when they rolled him through the bay doors. The paramedic giving report was a young woman who spoke fast and clearly. Suspected hemothorax, 2 large-bore IVs established, 1 liter in, pressure still dropping. Claire was already gloved when they transferred him to the bay gurney. She moved to his left side and pressed 2 fingers beneath his clavicle, tracking the anatomy of the injury by feel as much as observation. His trachea was midline. His neck veins were flat, not distended. She ran through the differentials in the 3 seconds before Dr. Marcus Doyle, one of Voss's senior residents, came through the curtain. Hemothorax suspected left, Claire said without preamble. Pressures 90/60 and trending. He's going to need a chest tube in the next... I can read the paramedic report, Doyle said. He stepped past her and addressed the patient. Sir, I'm Dr. Doyle. Can you tell me where it hurts? Pruitt coughed. It was a wet sound with a particular quality that Claire recognized and did not like. Everywhere, he managed. Can't... It's hard to breathe. We're going to take care of that. Doyle reached for his stethoscope. Claire said carefully, his pressure's continuing to drop. I'd recommend getting a portable chest x-ray immediately and alerting the thoracic team. Ms. Bennett? Doyle didn't raise his voice. He didn't need to. I've got this. She stepped back. She stood at the foot of the gurney with her hands at her sides and watched Doyle work through his assessment with methodical correctness that was slightly too slow for what she was reading in the patient's face. Pruitt's color was changing. His lips were going gray at the edges. His breathing was shallower and more labored with every passing minute, and the oxygen saturation monitor confirmed what she could see. Doyle ordered the x-ray. He ordered a 2nd liter of fluid. He called the respiratory therapist and made a note in the chart about monitoring. He did not order the chest tube. Claire looked at Pruitt. He was looking back at her in the way that patients look at nurses when they've decided the nurse might be the one who actually understands what's happening to them. She said quietly to Doyle, the fluid bolus isn't going to fix a hemothorax. It's going to buy you 20 minutes at best, and the x-ray will show you what I'm already telling you. He needs... I said I've got it. Doyle looked up from the chart. And if you say one more word about a chest tube without being asked, I'm going to have you reassigned to triage for the rest of your shift." She stopped talking. She moved to the medication station, updated the vitals in the chart, and pulled up the portable X-ray order that Doyle had entered to see when it was queued. 14 minutes out. She looked at Pruitt's pressure again. 84/58. She went to find Patricia. Patricia was at the far end of the corridor reviewing admission paperwork. Claire walked up beside her and said, at a normal volume, "Bay 3, trauma patient, construction injury, suspected hemothorax. His pressure is dropping and the attending is not moving to tube him. I need you to look at the chart." Patricia didn't hesitate. She set down the papers and walked. Claire walked with her. They had been in the bay for 30 seconds when Harlan Voss appeared in the doorway. "Ms. Bennett?" His voice was flat. "A word." Patricia glanced at Claire. Claire followed Voss into the corridor. "Dr. Doyle informed me," Voss said, "that you've been contradicting his assessment in front of the patient. I raised a clinical concern. You overstepped." He wasn't angry, which was somehow worse than anger. He was composed in the way of someone who has the authority to resolve the situation entirely in their favor and knows it. In this department, nurses support the treating physician. They do not second-guess, they do not counter-advise, and they do not go around the attending to the charge nurse to apply pressure. That is not your role. His pressure is dropping. Dr. Doyle has reviewed the patient. Then Dr. Doyle is going to watch him code in the next 40 minutes. Voss stared at her. It was the kind of stare that was supposed to make people retract what they'd said, lower their eyes, apologize, reframe. Claire looked back at him and said nothing further. She had said what she needed to say. "You are on your first day," Voss said finally, "and you are already a problem." He straightened. "You're going to finish your shift on administrative support, not patient contact. I'll be reviewing your assignment with the nursing director this afternoon, and I would not be surprised if this becomes a very short employment." He paused. "Do you understand me?" "I understand you," Claire said. She went to the nursing station, pulled up a chair, and began reviewing patient documentation with the careful attention of someone with nowhere better to be. From the station, she had a clear line of sight to Bay 3. She watched the portable X-ray machine roll in. She watched it roll out. She watched Doyle's posture change when the results came back. The particular stiffening of someone discovering that the person they dismissed was correct. And then she watched him move faster. She watched the thoracic resident arrive with the chest tube kit 11 minutes later. Pruitt made it. But it was close. She could tell from the way the nurses in the bay moved when it was over. The collective exhale, the extra moment before they started stripping gloves and cleaning up, that it had been close in a way that would stay with them. She turned back to her paperwork. At 2:15, Patricia stopped at the station and stood beside her without saying anything for a moment. Then she said, "Doyle put in the chest tube." "I know," Claire said. "Voss is going to make your life difficult." "I know that too." Patricia looked at her for a moment. "What did you do before this?" "Travel nursing, it says, but that's not—" She stopped herself. "Never mind, it's none of my business." "It's not," Claire agreed, not unkindly. Patricia nodded, started to walk away, then paused. "For what it's worth, you were right about the patient." "I know," Claire said again. At 3:45, Harlan Voss found her in the hallway outside the medication room and told her, with 2 nurses and a hospital security officer present as witnesses, that pending review of the morning's incident, she was to report to the administrative offices on the 4th floor and was not to return to the emergency department floor without explicit authorization from him or the nursing director. He said it quietly and professionally and with the air of someone doing an unpleasant but necessary thing. The security officer, a heavy-set man in his 40s named Roy, whose badge said Simmons, stood slightly to Voss's left with the careful neutrality of someone following instructions he had questions about. "You can't remove me from patient care because I was right," Claire said. "I can remove you from patient care because you violated departmental protocol and created a disruptive work environment." Voss folded his hands. "Those are documented facts, Ms. Bennett. The rest is your interpretation." "The patient needed a chest tube." "The patient received excellent care from Dr. Doyle." She looked at him for a long moment. She looked at Roy, who was looking at a point somewhere above and to the left of her head. She looked at the two nurses, who were both studying the floor. She picked up the pen from the nurse's station, signed the administrative transfer form that the nursing director's assistant had apparently already prepared and sent down, and handed it back. "Your documentation is wrong," she said to Voss. "You'll find that out." He smiled the smile again. "Fourth floor, Ms. Bennett." She was 12 feet from the elevator when the sound reached her. It started as vibration, a low thrumming in the windows that she felt in her chest before she consciously registered it. Then it became noise, a deep rhythmic chopping that grew from background to foreground in the space of 15 seconds. Every head in the corridor turned. The windows along the east wall of the ER rattled. Someone near the triage desk said loudly, "What the hell is that?" Claire stopped walking. She knew that sound. She knew it the way you know certain things, not from studying them, but from having them be the defining acoustic experience of months of your life. The specific blade frequency of a UH-60 Blackhawk in a descent approach was not something you forgot once you'd heard it at close range several hundred times over the course of a deployment. She turned and walked to the east window. The helicopter was coming down in the hospital's north parking lot. Not the helipad on the roof, but the ground-level lot, which meant it hadn't been coordinated through normal channels, and whoever was in it was not waiting for permission. It was a military aircraft. Two, actually. She could see the second one circling, but the first was already settling into the lot, its rotors flattening the air and sending a grocery bag cartwheeling across 4 parking spaces. People were pressing to the windows around her. The ER had essentially stopped. Nurses, residents, 2 attending physicians, a pair of orderlies, all of them crowded to the glass with the helpless fascination of people watching something they don't have a category for. "Is that the National Guard?" someone said. "Why would the Guard land in the parking lot? There must be a mass casualty. They'd use the roof." Roy, the security officer, was already on his radio. Voss was at the central station looking at his phone, trying to reach someone who could tell him what was happening. Patricia had appeared from somewhere and was standing near Claire, both of them watching the helicopter's rotors slow, the door slide open, uniformed personnel dropping to the asphalt with the practiced efficiency of people who do not waste time on landings. 4 soldiers. No, 6. Moving in a formation that was not ceremonial. Moving toward the hospital entrance with the deliberate speed of people who know exactly where they're going. "They're coming inside," someone said. "For a patient?" "I don't—" The radio at Roy's hip crackled. He listened for 3 seconds, looked up, and swept his eyes across the corridor with the expression of someone who had just been told something that didn't fit any category in his training. His gaze landed on Claire. "Ms. Bennett," he said slowly, and the way he said it made the corridor go noticeably quieter. "There?" He looked at his radio again as if verifying. "They're asking for you." The words took a moment to land. Claire watched Roy say them again because people near her were asking him to repeat it, because it made no sense in the context anyone in that building had for who Claire Bennett was. "They're asking for you. Not for a doctor, not for the chief physician, not for the administrator or the nursing director or anyone with a title that would logically explain why 4, now she could see through the lobby glass there were 8, military personnel in field uniforms had just landed 2 helicopters in the parking lot of Riverside Memorial Hospital on a Tuesday afternoon. Harlan Voss was staring at her. Patricia was staring at her. 23 hospital staff members were staring at her. Claire turned from the window. She set down the administrative transfer form she was still holding, had been holding this whole time without realizing it, and set it on the nearest surface with a particular kind of deliberateness. Through the lobby windows, she could see the lead soldier stop at the front desk. A brief exchange. The woman at the desk pointed toward the ER corridor. The soldier turned and looked down the hallway with the focused search of someone who already knows the face they're looking for. And his eyes found Claire's, and he stopped. He was young, late 20s, jaw set, the particular build of someone who had not had a sedentary year in their adult life. His uniform bore insignia she recognized without needing to read. He looked at her across the 30 feet of lobby and corridor between them with an expression she had seen before on different faces in different places, and it was not the expression of someone who had come to ask a favor. He had come because something was badly wrong, and he had come here specifically, and he had come here for her. The elevator behind Claire opened. Roy said her name again, uncertain now. Voss said something from the nurses' station that she didn't catch. She was already walking toward the lobby. His name was Sergeant First Class Damon Reyes, and the last time Claire had seen him, he had been bleeding out from a femoral laceration in a ditch outside Coast, while she packed the wound with both hands and told him in a voice she kept deliberately calm that he was not going to die today because she personally refused to allow it. He had believed her. She had been right. And now he was standing in the lobby of Riverside Memorial Hospital in Ashford with 7 soldiers at his back, and the look on his face was the same one she remembered from that ditch. Not panic, but the concentrated urgency of someone operating at the edge of what a situation allows. "Bennett," he said when she reached him. Not a greeting, a confirmation. "Reyes." She stopped 2 feet from him. "What happened?" "Convoy hit outside Milford Junction 3 hours ago. We have 4 casualties, 1 critical. We were 40 minutes from Fort Carver when he started crashing. We diverted here." He said it fast and flat, the way soldiers give information when seconds matter. "The critical is General Marcus Aldridge. He took shrapnel to the chest and abdomen, lost significant blood volume in transport. Pressure's been declining for the last 20 minutes. She felt the information register and settle. "What's your vehicle got?" Combat medic gave 2 units O-neg in the field, started a chest seal on the right side. "The seal's holding, but we're not sure about internal. He's conscious, but barely." "Where is he now?" "Coming through the east entrance, 2 minutes." She was already turning. Behind her she heard Voss's voice. "What is the meaning of—" And she did not stop walking. The east entrance to Riverside Memorial's emergency wing was a set of reinforced double doors used primarily for ambulance overflow. Claire pushed through them and felt the cold November air and heard the second helicopter still circling before she saw the vehicle. A military transport SUV with government plates pulling hard into the ambulance lane, followed immediately by a second. 2 soldiers were out before the first vehicle stopped moving. She approached the rear door as they opened it. General Marcus Aldridge was a large man, or had been before the blood loss. He was in his early 60s, gray-haired, wearing a torn field jacket over a shirt that had been cut open at the chest to allow access to the wound seal. His face was the color of old wax. His breathing was audible from 4 feet away, irregular, effortful, with the particular quality of someone working harder than they should have to for each inhale. The combat medic in the vehicle, a young woman with a staff sergeant's patch and dried blood on her forearms, looked up at Claire with the expression of someone at the end of what they can do. Penetrating chest trauma, right lateral, seals in place, no tension, but his breath sounds on the right are significantly diminished. "I'm worried about hemothorax. Abdomen's rigid. BP was 78/50 when we diverted. I don't have a current." "What's he on?" 1 milligram morphine 40 minutes ago. Nothing since." Claire leaned into the vehicle and looked directly at Aldridge. His eyes were open and tracking. "Good. General, I'm Claire Bennett. I'm going to take care of you." She put her hand on his forearm, not gently but firmly, the way you touch someone you need to anchor. "Can you tell me if the pain is localized or spreading?" He swallowed. "Spreading," he said. His voice was rough and quiet. "Left side now, too." She processed that. She straightened, turned to Reyes. "I need a trauma bay immediately. Full setup, chest tube kit, ultrasound, 2 large-bore IVs if they're not already running, type and cross for 4 units, and someone needs to call thoracic surgery right now, not in 5 minutes." "We're not going to get that from the doctor in charge," Reyes said. "I know. Wait." She looked at him. "That's why I'm telling you." She didn't wait for his response. She turned and went back through the east doors and walked directly to the trauma bay. Not to the nurses' station, not to Voss. She went to Trauma Bay 1, the largest, best-equipped bay in the department, pulled back the curtain, and began checking the card inventory with the fast, practiced efficiency of someone who has done this in considerably worse environments than a stocked American hospital. Patricia appeared at the curtain. "Claire, Voss is... I need you to call thoracic surgery and tell them we have a penetrating chest trauma with suspected hemothorax and rigid abdomen incoming. General officer, He needs an OR slot in the next 30 minutes. Patricia looked at her for 2 full seconds. Then she turned and went to the phone. Voss arrived at the bay before the soldiers brought Aldridge in. He came through the curtain with Roy Simmons at his shoulder and the particular rigid fury of a man whose authority has been bypassed in his own department. "Miss Bennett, you do not have clearance to operate in this bay. There's a critically wounded patient coming through your east entrance in approximately 60 seconds, Claire said. She was checking the laryngoscope. He has penetrating chest trauma and I believe internal abdominal bleeding. He needs a chest tube and ultrasound assessment immediately, and then he needs surgery. I have attending physicians. Then get one in here." She set the laryngoscope down and looked at him directly. "Get Dr. Reyes or Dr. Kamau, either of them, right now. I'll brief them and I'll step back. But somebody with a medical license needs to be standing in this bay in the next 30 seconds, or you're going to have a general officer die in your emergency department." That landed. She watched it land, watched the specific calculation move through Voss's expression. The word general did something to the air in the room that patient alone did not. He opened his mouth. He didn't get to close it before Damon Reyes walked through the curtain, and behind him, 2 soldiers carrying a field stretcher, and on the stretcher, Aldridge, who was making a sound with each breath now that nobody in the room could ignore. Reyes looked at Voss. He did not look at him the way the hospital staff looked at Voss. He looked at him the way soldiers look at obstacles. "Sir," he said, and the word contained no deference whatsoever. "This man is a 2-star general in the United States Army, and he is dying. Whatever jurisdictional issue you have with Sergeant Bennett can happen after. Right now, she's the most qualified trauma medic in this building, and I need you to get out of her way." The corridor behind Voss had filled. Staff were clustering at the curtain gap. Nurses, residents, the 2 attendings, Roy, an administrator in a blazer who had apparently come down from the 4th floor when the helicopters landed. They were all watching. Voss looked at Reyes. He looked at Aldridge on the stretcher. He looked at Claire. "She's a nurse," he said. The words came out slightly smaller than he'd intended. "She's a combat medic with 4 combat deployments and a Bronze Star," Reyes said. "She performed a field thoracotomy on one of my men outside Cost, with a headlamp and a kit half the size of what you have in this room. Now get out of her way." The room went very quiet. Voss stepped back. Claire moved. She directed the transfer from stretcher to gurney with 2 nurses, Patricia, who had reappeared, and a younger nurse named Thomas, who had the sense to move when she pointed. She got her hands on Aldridge's chest within 40 seconds of him entering the bay, pressing the assessment she needed through her fingertips. "Trachea deviated," she said, mostly to herself. "Right side." That was worse than she'd hoped. "Tomas, I need a 14-gauge needle. 2nd intercostal space, mid-clavicular line, right side. Now." Tomas moved. "Pressure?" she asked without looking up. 64/40, the staff sergeant medic read from the portable monitor. "Too low. Dropping." Dr. Adriana Reyes, no relation to the sergeant, a fact the universe apparently found amusing, pushed through the curtain. She was the younger attending physician Claire had noted that morning, and she came in reading the room with the fast competence of someone who had done this before. She stopped at Aldridge's left side, took in the monitor, the wound, Claire's positioning, and did not waste 3 seconds establishing hierarchy. "Talk to me," she said to Claire. "Tension pneumo developing, right side. Probable hemothorax, possibly bilateral, given his report of left side pain. Abdomen rigid, guarding upper quadrants. My guess is splenic involvement, but we need ultrasound to confirm. He's on 1 unit morphine from field, no other sedation. BP is 64/40, and I don't think it's going up on its own." Dr. Reyes processed this in real time, already reaching for gloves. "I'll do the needle decompression. It's set up. Go." They worked. It was not clean. It rarely was. Aldridge's pressure did not respond the way it was supposed to after the decompression, which meant the hemothorax was worse than the pneumo, which meant the chest tube couldn't wait. Dr. Reyes made the call, and Claire handed her the kit before she finished asking for it. Patricia managed the airway. Tomas ran fluids. The combat medic hovered at the periphery, watching with the visible relief of someone who has handed off a responsibility they were not equipped to carry alone. Harlan Voss stood at the curtain. He did not leave. He did not enter. He stood in the gap and watched Claire Bennett work in his trauma bay and said nothing, and Claire was too focused on the patient to notice or care where he was standing. The chest tube drained 400 milliliters of blood in the first 2 minutes. "That's the hemothorax," Claire said. "His pressure's coming up," Tomas reported. 71. "We need to move him upstairs. Abdomen is still rigid and I want a fast exam before he goes up, but thoracic needs to be ready to open him if that spleen is bleeding." "Thoracic is ready," Patricia said from near the phone. OR3. "Tell them 10 minutes." The fast exam, the ultrasound assessment of the abdomen, confirmed what Claire's hands had told her. Free fluid in the peritoneal cavity, concentrated around the spleen. Not catastrophic, but not stable. Aldridge needed surgery and he needed it now, and the window they had was measured in single-digit minutes. She stepped back when the surgical team arrived to transport him. She stripped one glove, then the other. She looked at the monitor. Pressure 83/58, heart rate 102, oxygen saturation 94, and climbing. Not good, but alive. She turned and found Damon Reyes standing just inside the curtain, watching her. He looked like he'd been holding his breath since the east entrance. "He's going to surgery," she said. "Probably 90 minutes in the OR. You should be able to see him in 3 hours." Reyes let the breath out. He rubbed his hand over his jaw. "You haven't changed," he said. "People don't change that much." "No." He looked at her for a moment. "You want to tell me why you're a nurse at a hospital in Ashford when the last letter I got from you, you were accepting a consulting position with the Army Medical Command?" "I declined it." "Why?" She looked past him to where Voss had been standing. The chief physician was no longer at the curtain. "Because something else needed doing first." Reyes followed her gaze to the empty curtain gap, then back to her face. His expression shifted. Not dramatically, but she'd spent enough time with soldiers to read the micro-adjustment, the recalibration. "Bennett," he said quietly, "is there something going on in this hospital I should know about?" Before she could answer, Roy Simmons appeared at the curtain with a face that had moved past its normal neutral register into something closer to alarm. Behind him was the nursing director, a woman named Sandra Chu, who Claire had met only briefly that morning during orientation, and who now looked like someone had just handed her a problem that was several sizes too large. "Ms. Bennett," Sandra said. Her voice was professionally controlled in the way of someone working very hard to keep it that way. "Dr. Voss has filed a formal complaint. Unauthorized assumption of clinical responsibility, failure to follow administrative directives, interference with attending physician authority." She paused. "He's asking for your immediate suspension and removal from the premises." The trauma bay was quiet. Tomas was cleaning up. Patricia had stilled near the supply cabinet. The combat medic looked from Sandra to Claire and said nothing. Reyes didn't move. "She just saved a general officer's life," he said. His voice was even, which somehow made it more dangerous than if he'd raised it. "In the next 5 minutes, I'm going to be on the phone with the base commander at Fort Carver, and in about 20 minutes after that, you're going to have people in this building who have questions about how this department operates. I'd think carefully," he said to Sandra, "about whose complaint you're executing right now." Sandra Chu looked at Reyes. She looked at the soldiers behind him. She looked at Claire. "I have protocols," she started. "Sandra," Claire said it quietly. "Where is Dr. Voss right now?" Sandra hesitated. "He went to his office to prepare documentation." "His office is on the 3rd floor," Claire said. "South wing." "Yes. There are no security cameras in the South Wing corridor between the stairwell and his office. I noticed that this morning." She held Sandra's gaze. "You might want to think about whether documentation prepared in that location, right now, without witnesses, tells you something." The silence stretched. From somewhere in the hospital, muffled by floors and walls but still audible, came the sound of a paging system, rapid and insistent, and then a second sound that cut through it. Raised voices from the direction of the main ER, the unmistakable pitch and volume of a situation unraveling faster than anyone had planned. Patricia was already at the door, her radio in her hand. She looked at the readout, then at Claire. and her face had lost all its careful professional composure. Mass casualty, she said. 40-car pileup on I-78. They're inbound. 14 units? Maybe more. ETA 6 minutes. She looked around the room, at the soldiers, at Sandra, at the blood still on the bay floor from Aldridge's transfer. We're not set up. Half the trauma bays are occupied from this morning's backlog, and Voss isn't... She stopped. Voss cleared 3 attendings for early out because census was low. 3 attendings. Gone. A mass casualty inbound in 6 minutes. Claire looked at Damon Reyes. He was already looking at her. How many of your people have trauma training? She asked. 4. 2 are combat medics. 1's a PA. Tell them to scrub in. She was moving before Sandra could object, before Roy could radio anyone, before the administrative complaint against her had done anything more than exist on paper in an office on the 3rd floor where nobody could see what was being written. The first ambulance was pulling into the bay when Harlan Voss pushed through the stairwell door at the end of the ER corridor, buttoning his coat, documentation folder under one arm, ready to formally and permanently end Claire Bennett's employment at Riverside Memorial Hospital. He stopped when he saw the ambulances. He stopped when he heard the number 14 incoming come over the department radio. He stood in the corridor with his folder and his documentation and his carefully prepared argument while the department scrambled around him, and Claire Bennett stood at the center of the bay allocation board, directing the incoming trauma flow with the flat, clear efficiency of someone who has organized chaos considerably worse than this. She did not look at him. She did not need to. What she did not know, what none of them knew yet, was that the 3rd ambulance pulling into the bay contained a patient who was not from the highway pileup, a patient who had been placed in that vehicle deliberately, a patient whose presence in Riverside Memorial's emergency department tonight was not an accident, and whose identity, when it became known, was going to make everything that had happened in the past 8 hours look like the quietest part of the story. The 3rd ambulance was running quiet. That was the first thing Claire noticed. No lights, no siren, just the vehicle pulling into the bay with a deliberateness that didn't match the controlled chaos surrounding it. Every other unit coming in was running hot, paramedics calling out vitals before the doors were fully open, the department's triage system straining under the weight of 14 simultaneous inputs. But the 3rd vehicle backed in slowly, and the 2 men who climbed out of the front were not wearing paramedic uniforms. She almost missed it. She had 4 patients being triaged simultaneously, was directing bay assignments with one hand and reviewing the incoming radio reports with the other, and the military PA, a compact, efficient man named Warrant Officer Grady, who had stopped asking for permission roughly 8 minutes ago and was simply doing what needed doing, had just flagged attention pneumo in Bay 4 that needed her attention. But she caught it. The way the 3rd vehicle's rear doors opened from the inside, not the outside. The way the 2 men from the front walked to the back, not to assist a patient, but to form a perimeter. Tomas, she said without breaking stride toward Bay 4. 3rd unit, find out who's in it and come find me. She was in Bay 4 for 6 minutes. The tension pneumo was straightforward. A 40-year-old woman from the highway pileup who had cracked ribs from the seatbelt and a lung that had decided to quit cooperating. Needle decompression, monitoring, transfer order upstairs. The woman grabbed Claire's wrist as she turned to go. Am I going to be okay? She asked. Her mascara had tracked down both cheeks, and she had a laceration above her left eyebrow that nobody had gotten to yet. Yes, Claire said. She meant it, which was the only reason she said it. Someone's going to stitch that cut in about 10 minutes. Try not to touch it. She left Bay 4 and found Tomas in the corridor with the expression of someone who had just received information they didn't know how to classify. The patient in Unit 3, he said quietly, is listed as a John Doe. No ID, no tags. The 2 men who came with him. They showed credentials to Sandra, but she won't tell me what kind. The patient has a gunshot wound to the upper left chest. Entry, no exit. He stopped. Claire. He's in a suit, like an actual suit, and somebody cut off his jacket and his shirt, and there's a badge holder around his neck, but the badge is gone. She stared at him for a half second, then she walked to Bay 6. The man on the gurney was in his late 50s, silver at the temples, with the kind of face that didn't give much away, even in this state. He was conscious. She could see his eyes tracking the ceiling, but his breathing was labored in a way that had nothing to do with panic and everything to do with physiology. His left shoulder and chest were packed with field dressing that someone had applied quickly and competently, not a paramedic's work. Something faster, harder trained. One of the two men from the ambulance front, tall, plainclothes, with the particular stillness of federal training, moved between Claire and the gurney. "This patient is not part of the general intake," he said. "He's in my emergency department and he has a gunshot wound to the chest," Claire said. "So yes, he is. Move." The man didn't move. From behind her, Damon Reyes' voice, "Agent, stand down." The man looked past Claire at Reyes. Something passed between them, recognition, or the specific acknowledgement of competing jurisdictions reaching a fast resolution, and the agent stepped aside. Claire moved in. She got her hands on the patient's chest, checked the dressing, checked his airway, checked his color. His BP on the portable monitor was 91/63, pulse 114, oxygen saturation 91%, which was low enough to matter. "Who packed this wound?" she asked. "I did." The second agent, shorter, who had stayed near the door. "Former Army, best I could do en route." "It's good work." She didn't look up from the patient. "How long ago was he shot?" 90 minutes, approximately." "Where?" A pause. "Parking structure, two miles from here." She looked up at that. Not at the agent, at the patient. He was watching her. His breathing was effortful but controlled, which meant he had training in pain management or simply the kind of stubbornness that overrode normal physiological responses. Probably both. "What's your name?" she asked him. He held her gaze for a moment, then slowly, "Whitmore, Deputy Director, Treasury." The room didn't react because only Claire, Reyes, and the two agents were in it, but Claire felt the information settle somewhere in the back of her mind, next to the things she'd been cataloging since she arrived at Riverside Memorial, and something clicked into alignment that she filed away for later. "Deputy Director Whitmore," she said evenly, "I need to do an ultrasound assessment of your chest and determine whether that bullet has done anything to your lung or surrounding structures. I'm going to need you to hold as still as possible." "Do what you need to do," he said. His voice was rough but steady. "And then I need to talk to you." "You can talk to me while I work." She called for the ultrasound cart, and Thomas brought it in 60 seconds flat, and she ran the probe across Whitmore's chest with the focused attention of someone reading a language they are fluent in. Hemothorax, moderate, blood in the pleural space, compressing the left lung but not yet critical. The bullet appeared to have passed through the outer chest wall and lodged against or near a rib without penetrating the lung parenchyma. Lucky. Not safe, but lucky. "You need a chest tube and you need it in the next 20 minutes, she told him. "And then you need a CT to confirm where that round is sitting before we do anything else." "Understood." He exhaled slowly. "You're Bennett." She paused for just a fraction of a second. "Yes." "I know why you're here," he said. "Not the official story, the real reason." She looked at him. "So do I need to wait until after the chest tube," he said, "or can we—" "After the chest tube," she said. "Hold still." She worked fast and without wasted motion, which was the only way she knew how to work. Tomas assisted. Reyes stayed near the door. The two agents maintained their positions with the patience of people accustomed to waiting in bad situations. Outside Bay 6, the department continued its organized chaos. She could hear it, calibrate it, track which sounds required her attention and which didn't. A faculty she'd developed over 4 years of doing exactly this in environments where the background noise was considerably more dangerous than an overburdened ER. The chest tube drained 260 milliliters. Whitmore's oxygen saturation climbed to 95 within 4 minutes. His pressure stabilized at 98/68, which wasn't perfect but was sustainable. She stripped her gloves. "Talk." Whitmore looked at the agents. The shorter one nodded and moved to the curtain, pulling it fully closed. The taller one checked the corridor and came back inside. "Deputy Director Whitmore is the head of a joint Treasury DOD Financial Crimes Task Force," Reyes said from his position near the door. He said it with the tone of someone delivering a briefing they've already internalized. "The investigation involves fraudulent Medicare and Medicaid billing, falsified mortality records used to support insurance settlements, and the systematic suppression of adverse incident reports at a number of regional medical facilities. Claire looked at Reyes. How long have you known about this? 3 weeks. Aldridge brought me in because 2 of the facilities under investigation had military personnel records tied to them. Soldiers who died in care that shouldn't have. Which facilities? Whitmore spoke. Riverside Memorial is primary. There are 2 satellite clinics, but the billing hub runs through this hospital. He adjusted slightly on the gurney and winced. We've had an undercover financial analyst inside the administrative structure here for 4 months. Last week, she flagged a pattern in the mortality records. Patients who died under circumstances that don't match the official cause of death, whose families received settlements structured to prevent litigation and public record. Claire felt the coldness settle over her the way it always did when something she'd suspected became something she knew. How many patients? Confirmed, 11. Probable, more. And the person running it? Whitmore looked at her steadily. The billing authorization at the physician level goes through the department chief. The name didn't need to be said, it was already in the room. Voss, she said. He's not alone. 2 administrators are implicated, and we believe at least 1 other attending physician has been signing off on falsified records knowingly. But Voss is the operational center. Whitmore paused. You applied for this position 8 weeks ago. We know you did your own research before you arrived. What tipped you? She looked at him. The mortality review. The one the state health board flagged but never acted on. The mortality rate in this ER for patients admitted with abdominal trauma is 17% above the state average. That's not a staffing problem or a resource problem. It's a decision problem. She picked up the patient chart and made a notation. I put in for this position because I wanted to see it from the inside. I wasn't sure I'd find anything. I found it in the first 3 hours. Dale Pruitt, Reyes said. He nearly died from a treatable injury while the attending stalled. I don't know yet whether that was incompetence or deliberate, but the pattern it fit, the way Doyle hesitated, the way Voss arrived to manage the nurse rather than check on the patient, that's not how a department runs when it's just understaffed. Whitmore nodded slowly. We need the physical records. Our analyst identified a server room on the 4th floor where billing documentation is stored locally before it's transmitted to the insurance processor. If Voss becomes aware that we're in the building with this conversation, or that Aldridge is here, he may attempt to purge those records. Claire looked at Reyes. Reyes pulled out his phone, and that was when the fire alarm went off. Not a test. The fire panel in the corridor outside Bay 6 lit simultaneously with the alarm, and the automated voice began its loop, and the sprinkler heads in the ceiling trembled with pre-charge pressure. Through the curtain, Claire could hear the department surge into the particular controlled anxiety of an emergency within an emergency. Staff calling out, patients asking questions, someone near the nurses' station shouting about evacuation protocol. Tomas came through the curtain. His face was pale. It's not a fire, he said. It's the server room. 4th floor, south wing. Someone pulled the halon suppression system. It's a clean agent system. It doesn't use water, but if it discharged in a room full of servers, it would destroy everything on those drives, Claire said. The fire department is going to want to evacuate. Reyes. She turned. He was already on the phone, talking fast and low. He held up one hand, I've got it, and stepped toward the corner of the bay. The 2 federal agents had shifted posture entirely, from watch and wait to operational in the space of 3 seconds. Whitmore tried to sit up. Don't, Claire said. Those records are not your problem in the next 60 seconds. Bleeding out in my bay is. She put her hand on his shoulder, firm, unapologetic, and he stopped. He looked at her with the particular expression of powerful men who are unaccustomed to being physically overruled and are deciding how to respond to it. He settled back. You're going to CT, she said. And then you're going to a room with a guard, and the records problem is going to be handled by people who are not currently attached to a chest tube. By who? She looked at the curtain where Reyes's voice was still moving fast and quiet. The people who landed 2 helicopters in the parking lot. She got Whitmore to CT with Tomas and one of the agents. She came back into the corridor and found Reyes off the phone, standing with 2 of his soldiers, and the look on his face told her what she needed to know before he said it. 2 of my guys are on the 4th floor, he said. Server room is intact. The halon discharged, but the system malfunctioned, or was made to malfunction, before it completed the cycle. The drives are damaged but not destroyed. Our tech team is 20 minutes out. Who pulled the suppression system? Reyes looked at her. Security footage shows a man in a white coat. The noise that had been the background of this whole conversation, the alarm, the department chaos, the multiple crises layered on top of each other, suddenly sharpened into a single point. Claire looked down the corridor toward the stairwell. "Where's Voss?" she asked. Nobody answered immediately, which was itself an answer. She moved. She went to the nursing station and pulled up the badge access log on the administrative terminal, the one that tracked entry and exit through the secured corridors. Patricia was there, looking hollowed out and alert in the way of night shift nurses at hour 14. "Fourth floor south wing badge access," Claire said. "Last 30 minutes. Patricia pulled it. 2 entries. One was the nursing director. One was a physician badge, and the number corresponded to a code Claire had memorized that morning out of simple professional habit because she had made a point of memorizing the badge codes of the department's senior physicians on her first day. Harlan Voss had accessed the 4th floor south wing server room 14 minutes ago and had not badged out. She was already turning when she heard it, not loudly, not dramatically, but clearly enough to cut through the alarm and the noise and the managed chaos of the department. A sound from the direction of the stairwell, something heavy hitting something solid. Then quiet. Then Roy Simmons's voice on the department radio, strange and thin. I need someone at the 3rd floor stairwell landing. I've got a pause. I've got Dr. Voss. I think he's, you need to send someone." Claire moved toward the stairwell. Reyes caught her arm, not to stop her, to go first. 2 soldiers took the stairwell door ahead of her and she followed them up, one flight, to the 3rd floor landing where Roy was crouched beside a man on the floor. Harlan Voss was conscious, but barely, sitting against the wall with his hand pressed to his left side, an expression on his face that she had never seen on him before because it was not composed or authoritative or coldly amused. It was frightened. The folder he'd been carrying, the documentation, the formal complaint against her, all of it, was scattered across the landing in a wide arc, pages overlapping on the concrete like something that had been thrown rather than dropped. Roy looked up. "He was like this when I came in. I don't know what—" "Did anyone come past you?" one of the soldiers asked. "I wasn't watching the stairwell. I was on the floor." Claire crouched in front of Voss. She moved his hand away from his side. No blood. She ran her hands along his ribs, his abdomen. No signs of external trauma, but his color was off, grayish, sheened with sweat, and his breathing was irregular in a specific way she recognized. "Voss," she said his name flat and direct. "Look at me." He looked at her. His eyes focused, then unfocused, then found her again. "Did you take something?" she asked. "Or was something given to you?" His jaw worked. "I don't—" He stopped. "The coffee. In my office. Tasted wrong." She looked at Reyes, who was already on his phone again. Whatever Voss knew, whatever documentation he held, whoever had been working alongside him in the billing fraud, someone had just decided that a frightened, disoriented chief physician talking to federal investigators was a liability they couldn't manage. Someone who was still in this building. Someone who had known that the moment the military walked through those doors, the architecture of the whole scheme started cracking. Claire looked at the scattered pages on the landing. She looked at Voss, who was shaking now, in the specific way of a man whose body is being overruled by a substance he didn't know he'd ingested. She looked up at Reyes. "He needs to be in the department," she said, "and he needs to be observed, which means I need to know what he took." "How do we find out?" "His office, the coffee cup. Get one of your people up there right now before anyone else does." Reyes relayed it. He was off the phone in 12 seconds. She stayed crouched in front of Voss, monitoring his pulse at the wrist, watching his respiration. He was looking at her with something that was not gratitude and not calculation, but something in between. The specific look of a man who has spent years measuring people by their usefulness to him and is now, for the first time, on the other side of that ledger. "You knew," he said. His voice was thick. "When you came in, you already knew." Not everything, she said. Why didn't you? He stopped, swallowed. Why are you helping me? It was not exactly a question. She treated it like one anyway. Because you're a patient, she said. That's the only reason that matters right now. She stood and looked at Reyes. Behind him, down the stairwell, she could hear the department continuing. The alarms, the patients, the ongoing catastrophe of a mass casualty event being managed in an already compromised space. Aldridge was in surgery. Whitmore was in CT. 14 highway casualties were distributed through a trauma department that was running on 4 nurses, 2 military medical personnel, 1 attending physician, and whatever organizational structure Claire had built in the last 40 minutes. And somewhere in this building, someone who had just poisoned the chief physician of the emergency department was still moving. She didn't know who, not yet. But she knew one thing. Whoever it was had access to Voss's office, had known exactly when to act, and had done it with the calm precision of someone who had prepared for this contingency in advance. She looked down at Voss and then at the scattered pages of his formal complaint against her, spread across the concrete of the stairwell landing. And in the middle of those pages, mixed in with the documentation of her supposed violations, her unauthorized clinical decisions, her interference with attending physician authority, was a single sheet that had not been part of any complaint. She could see only part of it from where she stood. A table, columns of numbers, and at the top, a header that read Q3 Reconciliation, Adjusted Outcomes. She picked it up. She looked at it for 3 seconds. 11 names. Dates, admission diagnoses. And in the final column, next to each name, a dollar amount that bore no relationship to any legitimate medical billing code she had ever seen. This was not something Voss had prepared to file against her. This was something he'd been carrying, something he'd taken from the 4th floor server room before she got there, something he had maybe planned to use as leverage, or evidence, or insurance. And now the person who didn't want it to surface had put something in his coffee. Reyes looked at the page over her shoulder. He said nothing for a moment, then, "That's the list." "Yes," Claire said. "Bennett." His voice was quiet and specific. If whoever did this thinks Voss took something off those servers, they're not done. They're going to come back to make sure this, he gestured at Voss, finishes. She folded the page carefully and put it in her breast pocket. She looked at Reyes. She looked at Roy, who was watching this exchange with the expression of a man reassessing every assumption he'd made since 6 o'clock that morning. "Get 2 of your people on Voss," she said to Reyes. "Don't let anyone without military clearance near him." She started for the stairwell door. "And get someone to find Dr. Kamau. He's the only attending I trust in this department right now." "Where are you going?" She pushed the door open. "Back to the ER," she said, "because someone just walked into my department who doesn't belong here, and I'm going to figure out who before they figure out that Voss didn't die." The emergency department looked different from the stairwell door than it had 3 hours ago. Same walls, same floor, same overhead lighting that turned everyone slightly yellow. But the energy had shifted in the way that spaces shift when the people inside them have been through something that changed the terms of everything. The mass casualty patients were distributed and stabilized, the worst of them already upstairs, the walking wounded triage to the waiting area with ice packs and paperwork. The alarm had stopped. The sprinklers had not fired. What remained was the aftermath quiet, the specific, exhausted hum of a department that had sprinted and was now cooling down, catching breath, beginning to think. Claire walked back in and started counting. It was a habit from deployment, entering any space and immediately accounting for who was present, who was moving, who was still. Patricia at the central station. Tomas in Bay 2 with a patient. Warrant Officer Grady near the medication room, writing notes in the economical shorthand of someone trained to document under pressure. Doctor. Adriana Reyes at the far end talking to a family, her back to the room. 2 of Reyes' soldiers near the east entrance, positioned where they could see both the interior and the parking lot. She counted 17 people. 14 she could account for. 3 she could not place immediately. A man in scrubs near the supply corridor. A woman she didn't recognize at the medication station printer, and a figure moving through the far end of the department in the direction of Bay 6. Bay 6 was where Whitmore had been. She walked toward it without changing her pace. The figure turned before she reached the curtain. He was a man in his mid-40s, average height, wearing scrubs and a Riverside Memorial ID badge that, from 6 feet away, looked completely legitimate. He had a tablet under his arm and the expression of someone executing a routine task. He looked at Claire with the mild, professionally vacant expression that hospital staff develop as protective coloring. The look that says, "I belong here," without requiring any specific credential. She had seen that look before, on people who genuinely belonged and on people who were very good at pretending. "Which patient are you looking for?" she asked. He blinked. "Bay 6, post-procedure check." "Bay 6 is empty. Patient transferred to CT 40 minutes ago." She held his gaze. "Which attending ordered the check?" A pause. Just a fraction of a second too long. "Dr. Voss," he said. "Dr. Voss isn't available." She kept her voice even. "Badge number?" He looked at her. His expression had not changed, still mild, still professionally vacant, but something behind the eyes had sharpened in the way of someone rapidly recalculating. "I'll come back," he said, and turned. She said, "Grady." Warrant Officer Grady was across the department in 4 seconds. The man in scrubs had made it 6 feet toward the supply corridor when Grady fell into step beside him with the quiet authority of someone who does not need to raise his voice to make a situation change. "Sir," Grady said, "I need to see your badge." The man stopped. He looked at Grady. He looked at Claire. He looked at the 2 soldiers near the east entrance who had noticed and repositioned without being told. He made the calculation that people make when the available exits have closed, and Claire watched him make it and watched him arrive at the same conclusion anyone reasonable would arrive at. "I want a lawyer," he said. "That's not something I can help you with," Grady said pleasantly, "but I can find you somewhere comfortable to sit." He walked the man to the chair near the nurse's station with a hand that was not rough but was absolute. Claire pulled the badge off the man's lanyard before he sat. The name on it said R. Forsyth, Environmental Services. The photo matched. The badge number, when she ran it on the administrative terminal, was active and legitimate. But environmental services staff did not check on post-procedure patients in trauma bays. She looked at Reyes, who had come down from the stairwell and was standing behind her now. She turned the badge so he could see it. "Run the name," she said. Already on it. He had his phone to his ear. She left Grady with the man in the chair and went to find the third person she couldn't place, the woman at the medication station printer. But when she reached the printer, the woman was gone. The printer was running, outputting pages that turned out to be routine medication reconciliation forms, entirely mundane, which meant either the woman had been legitimately printing and had finished, or she had been doing something at that printer that she'd completed before Claire got there. Claire checked the printer's job log. 3 documents. The first 2 were the medication forms. The third was a single-page internal transfer request for patient records. 11 records, specific names, specific dates, flagged for release to an external billing auditor. The document had been submitted 4 minutes ago. The request was already in the system. She stared at the names on the print copy. 11 names. Same 11 names as the document she'd taken from the stairwell landing, folded in her breast pocket. Somebody had just tried to pull those records out through a legitimate administrative channel, disguise the extraction as a routine audit request, get the files out of the system before the federal team's forensic technicians arrived to lock it down. She went back to the station and pulled up the user log for the printer terminal. The session had been opened with a valid administrative credential. The name attached to that credential was Sandra Chu. Claire stood very still for a moment. Then she went to find Sandra. The nursing director's office was on the 2nd floor, east wing. Claire took the stairs, not the elevator, which was a habit she'd had since Kandahar, and saw no reason to break. The corridor on 2 was quieter than the ER. Administrative territory, carpeted, the particular institutional hush of offices where decisions get made at a remove from the consequences. She knocked on Sandra's door once and opened it before anyone said come in. Sandra was at her desk. She was on the phone, speaking quietly, and she looked up when Claire entered with the expression of someone who had been waiting to be interrupted and was not surprised it was by this particular person. She said into the phone, "I'll call you back," and put it down with the deliberate care of someone controlling their hands. "Miss Bennett," she said. "The medication printer on the 1st floor," Claire said. Someone used your credentials 4 minutes ago to submit a records transfer request. 11 patient files. External billing auditor, no audit number, no department authorization. Sandra's hands were flat on the desk. Her expression had not changed. My credentials are shared with my assistant, she said. Where's your assistant? She went home at 3 o'clock. Regular hours. Then who used them? Sandra looked at her for a long moment, and then something shifted. Not dramatically, not the way it shifted in the stairwell with Voss, but in the quieter way of someone who has been carrying something heavy for a long time and has reached the specific exhaustion where setting it down feels less like surrender and more like relief. Close the door, Sandra said. Claire closed it. I didn't know what it was at the beginning, Sandra said. I want you to understand that. The billing structure, well, Voss brought it to me 2 years ago as a revenue optimization initiative, adjusting claim codes, reclassifying procedures. It sounded like standard administrative practice. Hospitals do it. She stopped. Then I saw the mortality list, and by then I had already signed enough documentation that I was inside it, whether I understood it or not. You were covering it, Claire said. I was surviving it. Sandra's voice was flat, which I know is not a distinction that matters legally. Who used your credentials just now? Sandra was quiet for 2 seconds. His name is Martin Forsyth. He's not environmental services. He's Voss's personal attorney's investigator. He has a hospital badge because Voss arranged it 8 months ago when the first state inquiry came in. His job is to manage documentation when things get complicated. His brother is sitting in a chair in my ER right now, Claire said. Sandra blinked. What? The man in the scrubs, R. Forsyth on the badge. He was heading for Bay 6. Something moved through Sandra's expression that was close to horror. There were 2 of them? There were 2 of them. Claire put her hands on the desk and leaned forward. Sandra, a federal deputy director is in this hospital right now with a gunshot wound. General Aldridge is in surgery, and whoever shot Whitmore and whoever poisoned Voss's coffee is still trying to clean up the evidence from inside your administrative system. So I need you to tell me everything you know right now, and I need you to tell me who else in this hospital is involved. The silence lasted 4 seconds. Then Sandra reached into her desk drawer and put a USB drive on the desk between them. I copied what I could from the billing server 2 weeks ago, she said, when I realized the federal inquiry was going to be real. She looked at the drive. I was going to give it to someone. I didn't know who. Claire picked it up. She left Sandra's office and went back down to the ER and put the drive in Reyes's hand without explaining the origin, because the origin was something for investigators to establish on their own terms, and she had 4 other things to track simultaneously. Reyes looked at the drive and looked at her and made a phone call that lasted 90 seconds and ended with him saying quietly, "They're 10 minutes out." The federal forensic team arrived at 9 minutes and 40 seconds, Claire counted, in 3 unmarked vehicles through the ambulance bay. 6 people with equipment cases, led by a woman in her late 30s who moved through the department with the practiced invisibility of someone who does this often enough to know that the best way to not disrupt an active clinical space is to look like you belong in it. She stopped at Claire, looked at her once, and said, "Bennett?" "Yes." "Supervisory Agent Danielle Park, Treasury DoD Joint Task Force." She didn't extend her hand. Both were occupied with equipment. "We're going to need the 4th floor server room, the billing records you recovered from the stairwell, and access to the administrative credential log from the past 72 hours. The stairwell document is in my pocket," Claire said, and gave it to her. "The server room is accessible via badge. Reyes has cleared the corridor. Credential log is on the administrative terminal, 2nd screen, badge access submenu." Park looked at her for a moment. "You've been holding this together by yourself." "Not by myself," Claire said. She went back to work. The next 2 hours were not cinematic. They were the particular grinding, unglamorous work of an emergency department processing the tail end of a mass casualty event while simultaneously being the location of a federal investigation. Competing traffic, competing needs, the constant friction of 2 completely different operational logics occupying the same physical space. Claire worked. She checked the remaining highway patients, updated documentation, coordinated with the ICU on 3 transfers, and got a report from Dr. Adriana Reyes on Aldridge's surgical status. Stable, out of the OR, in recovery, prognosis good. She went to check on Voss. He was in Bay 1, the bay she'd prepped for Aldridge, which felt like a long time ago, with an IV running and 2 of Reyes's soldiers outside the curtain. The toxicology team had identified the substance in the coffee cup from his office, a benzodiazepine compound at a dose calculated to cause significant impairment and apparent natural collapse, not death, which told her something about how the person who put it there had assessed their options. They wanted Voss incapacitated, not dead. A dead chief physician was an immediate investigation. An impaired one, found collapsed, perhaps from stress, perhaps from something that could be attributed to personal history, was a slower unraveling. She checked his vitals. His color was better. His hands had stopped shaking. He was awake, and he was looking at the ceiling with the expression of a man conducting a very thorough internal review of his recent decisions. "Voss?" she said. He turned his head. For a moment, neither of them said anything. The silence had a different quality than it had had in the corridor that morning. Not his contempt and her resistance, but something flatter and more complicated. "The patient this morning," he said finally. "Pruitt. He's upstairs. He's going to be fine." Doyle waited too long. "Yes." "I told him." Voss stopped. "I told him to follow the protocol, which I wrote partly because it created a billing window before surgical consultation. He said it to the ceiling, not to her. I didn't think anyone would be harmed. The protocol allowed for adjustment based on patient presentation." "Except in practice it didn't," Claire said. "Because you created a culture where residents didn't adjust. They followed the chart because deviating from your protocol had consequences." He was quiet. "Yes." "How many of the 11 knew what they were being admitted to?" A long pause. "None of them. The billing reclassification happened after. Patient dies of documented complication. Estate receives settlement. Death is coded to a different primary cause. The difference in insurance payout goes to a holding account." He finally looked at her. "It started as padding. It became..." He stopped again. "It became killing people for the money their deaths generated," Claire said. He didn't deny it. She hadn't expected him to. "Who administered the compound in your coffee?" she asked. "I don't know," he said. And then, after a pause, "I have a guess. Tell the investigators." "I will." He looked at her with the specific, exhausted clarity of a man who has run out of angles. "Why did you come here? The real reason. You weren't just suspicious about the mortality rate." She considered telling him it was none of his business. She considered telling him the partial truth she'd told Whitmore. She decided on the version that was closest to complete. "My brother was a patient here," she said. 14 months ago. Admitted with abdominal trauma from a car accident. He was stable. He died 3 days later of what was documented as a septic complication." She looked at him steadily. "His name is on Whitmore's list." Voss closed his eyes. She left the bay. She stood in the corridor for a moment, just outside the curtain, with one hand flat against the wall. Not a collapse. Nothing so dramatic. Just the particular weight of having said it out loud in the place where it happened, to the person most responsible for it happening. It settled differently than she'd expected. Not lighter, not heavier, just settled. Patricia appeared at her shoulder without a word and stood there for a moment in the way of someone who understands that proximity is sometimes more useful than anything spoken. Then Patricia said quietly, "Park is upstairs. They found something." Claire took her hand off the wall and went upstairs. The 4th-floor server room was a medium-sized space that smelled of halon discharge and hot electronics. Agent Park was standing at a workstation with 2 of her technicians, reviewing a display that showed a directory structure Claire couldn't fully read from the door. Reyes was near the window. The taller federal agent from Bay 6, Whitmore's man, was in the corner making notes. Park turned when Claire entered. "The drives are partially damaged from the discharge, but our forensic tools are recovering approximately 70 to 80% of the data. What we have is enough." She paused. "Enough to be more than enough." She clicked to another screen. Billing records spanning 4 years. Revenue reclassification across 214 individual patient encounters. 11 confirmed mortality cases with falsified cause of death documentation. Settlement payments routed through 3 shell entities registered in Delaware, Nevada, and 1 offshore. She turned from the screen. There is also, and this is separate from what you gave us from the stairwell, a series of internal communications between Voss and a co-conspirator inside this hospital. Someone at the administrative director level who coordinated the settlement payments. Sandra Chu, Claire said. Park looked at her. You knew. I suspected. She told me herself downstairs. She also gave me the drive I passed to Reyes. Park absorbed this with the practiced efficiency of someone who integrates new information in real time without reacting to it personally. Sandra Chu cooperating changes some of the timeline of our prosecution, but not the charges against her. What it gives us is the name of the external attorney coordinating the settlement structure. She pulled up a name on the screen. A man named Leonard Forsythe. His investigator is downstairs in federal custody, Claire said. Park almost smiled. We know. His brother walked into local custody approximately 8 minutes ago. She closed the screen. Ms. Bennett, Deputy Director Whitmore asked me to tell you that when he's medically cleared, he'd like to speak with you personally. He also authorized me to tell you that the investigation has been active for 7 months, that your independent decision to place yourself inside this hospital was not coordinated with this office, and that it both complicated and substantially accelerated our timeline. She paused. He said, and I'm quoting, "Tell her she made a hell of a mess and probably saved the whole case." Claire looked at her. Did he make it through CT? Bullet is lodged against the 5th rib. Lung is intact. He goes to surgery in the morning. Good. She went back downstairs. The department at 11:15 p.m. looked nothing like the department at 6:40 that morning. Same walls, same floor. She kept coming back to that, the way a space persists through what happens inside it. But the staff moving through it had been changed by the day in the visible way of people who have been forced to reckon with something they'd been managing not to see. Tomas was charting at the station with a thoroughness that had an almost defiant quality. Dr. Adriana Reyes was talking to Patricia in the break room doorway with the lowered voices and shared exhaustion of people processing the same event from different angles. Even Roy Simmons, standing near the triage desk, had the look of someone who had spent the day revising the story he told himself about the place he worked. Warrant Officer Grady found Claire at the nurse's station and handed her a printout. Forensic team pulled the security footage you mentioned. South wing corridor, 3rd floor, no cameras. I know. But there is a camera at the South wing elevator. Timestamp from tonight, 17 minutes before Roy found Voss on the stairwell landing. He tapped the printout. It was a grainy still frame, corridor lighting, slightly washed out. A man in a white coat walking toward the stairwell door, seen from behind, but the build, the posture, the way he held the tablet case under his left arm. That's Doyle, Claire said. Grady nodded. Dr. Marcus Doyle, the resident. He had access to Voss's office? Voss gave him a key 4 months ago. He was being groomed. Grady said the word with a flatness that indicated what he thought of the concept. Our people pulled his phone records in the last hour. He's been in contact with Leonard Forsythe's office 11 times in the past 3 months, twice in the last 48 hours. She looked at the still frame for a moment. Doyle, the resident who had delayed the chest tube on Dale Pruitt that morning. The first person who had dismissed her in this department before Voss had the chance. She hadn't read him as malicious that morning, just overconfident, and trained to follow a chief's lead without questioning it. But overconfidence and training were useful tools for people who needed a resident with legitimate access and a willingness not to ask why. Where's he now? That's the thing. Grady took the printout back. He badged out at 9:57. He's not in the building. She thought for a moment. His car is in the lot. I saw it when I came in this morning. Blue sedan, 3rd row. How do you know which car is his? He was parked next to me. I noticed. She looked toward the east entrance. If he left on foot, he didn't have a plan. He panicked, which means he's not far. She relayed this to Reyes, who relayed it to the 2 federal agents who had by this point been joined by 3 more. She did not follow it. It was not her operation to run, and she had enough to manage in the building she was already in. She went back to her patients. At 12:41, Damon Reyes found her in Bay 3, where she was monitoring the last of the highway casualties. A 19-year-old with a mild concussion who had fallen asleep 20 minutes ago and whose mother had driven 2 hours from Clarkfield and was sitting in the plastic chair beside the gurney with her coat still on, holding her daughter's hand. Reyes waited until Claire stepped out of the bay. Doyle was picked up at the Ashford train station, he said. 12:38. He had a go bag. She nodded. Prepared then. Just not fast enough. He's talking. Park says he's been talking since before they got him into the vehicle. Reyes paused. He's scared. He should be. He's naming everyone, the 2 administrators, the billing routing structure, the offshore account details. He looked at her. He's also naming Voss as the primary architect of the mortality reclassification, not just the billing padding. He says Voss identified which patients were high-value liabilities and flagged them for, he used the phrase, outcome management. The phrase sat in the air between them. That's what my brother was, Claire said. An outcome to manage. Reyes was quiet for a moment. He looked at the floor, then back at her. I'm sorry, Bennett. I didn't know why you were really here until tonight. You didn't need to. I should have asked. You would have tried to talk me out of it, she said, and I would have come anyway. He looked at her with the expression of someone acknowledging a fact they find simultaneously frustrating and entirely characteristic. Yeah, he said. You would have. She almost smiled. It didn't quite reach her face, but it was there in the vicinity. She went back to the department. There were still patients. There would be for the rest of the night, and the night after, because that was the nature of an emergency department, and of the work she had chosen and kept choosing every time she had the option to choose something else. At 1:15 in the morning, Harlan Voss was moved from Bay 1 to a room on the 3rd floor under guard. He walked out of the bay on his own 2 feet, which she had not expected. Had expected a wheelchair, or at minimum the shuffle of someone who had been through what he'd been through in the past 9 hours. But he walked, and when he passed the central station where Claire was standing, he stopped. He did not say anything immediately. The corridor was not empty. Patricia was 6 feet away, Tomas was at the medication cart, one of Reyes's soldiers was at the east wall, but nobody was directly between them. You judged my title instead of my ability, Voss said, in the corridor this morning, when I dismissed you. He said it the way people say things they've been running through their head for hours, refining the phrasing until it lands somewhere close to honest. I had done that to a lot of people. I was going to do it again and move on, and it was not going to cost me anything. He stopped. I was wrong. She looked at him. She did not tell him it was fine, because it wasn't. She did not tell him she forgave him, because that was not something she was prepared to determine in a hospital corridor at 1 in the morning. She said what was true and immediate. The investigation will establish what you did and what it cost, she said. That's not mine to determine. He nodded. Once. Then the soldier from the east wall walked him toward the elevator, and he went without resistance. She stood at the station for a moment. Then she pulled out her phone and sent a message to Reyes. Where is the administrative director? Confirmed custody? His reply came in 40 seconds. Both admin directors in federal custody as of 1100. Sandra Chu in separate hold, cooperating. Leonard Forsyth arrested at his office at 2200. Full picture. She put the phone away. The department was quiet now. The particular late-night quiet that was not the absence of work, but the presence of a different, slower kind. Monitoring. Documentation. The long, sustained attention that acute medicine required after the acute phase was over. She was writing notes at the station when Patricia set a coffee cup down beside her without a word. Real coffee, not the machine variety. Claire looked at it, then at Patricia. I've had it in my office for emergencies, Patricia said. This seemed like an emergency. Claire picked it up. It was good. Dark, slightly bitter, the kind of coffee that tasted like someone had made it with the understanding that the person drinking it had not slept. Patricia, she said. How long did you know something was wrong? Patricia was quiet for a long moment. She looked at the station, at the overnight documentation, at the department that had been her professional home for almost 2 decades. Long enough that I should have done something, she said. Not long enough that I understood what I was looking at. She paused. I thought the mortality rate was a resource issue. I wrote 3 memos about staffing. She stopped. They went to Sandra. Who filed them? Who filed them? Patricia agreed quietly. Claire looked at her coffee. Your memos are going to matter. For the record. They filed them. Federal investigators can unfile things. Patricia looked at her for a moment. She nodded. Then she picked up her own coffee and went back to work, and Claire went back to her notes, and the department ran on around them in the particular steady rhythm of a place that had been through something and was still standing. It was 2:47 in the morning when Agent Park appeared at the station with a tablet, and the expression on her face was not the measured professionalism Claire had seen all evening, but something closer to focused alarm. We have a problem, Park said. Claire set down her pen. The offshore account, Park said. The one the settlement payments were routed to. We've been tracing the structure. The Delaware entity, the Nevada entity, the offshore shell. Standard layering. But the final beneficial owner, the person who actually received the money, is not Voss. It's not Forsyth. It's not either of the administrators. She turned the tablet so Claire could see the screen. It's a trust registered under a name we've been looking at for 8 months for a completely different federal investigation, a name that doesn't belong in a regional hospital billing scheme. Claire looked at the screen. She looked at the name. She looked at Park. That's a Pentagon contractor, she said. Yes, Park said. They were using the hospital's billing fraud to launder contract payments. That's our current working theory, which means this is not a regional scheme. Park pulled the tablet back. This goes considerably higher and considerably wider than Riverside Memorial, and the person whose name is on that trust, she stopped. He has a meeting scheduled at Fort Carver tomorrow at 9 a.m. with General Aldridge. The department continued its quiet nighttime work around them. A monitor beeped in Bay 2. Tomas moved past with a supply cart. Somewhere upstairs, in a recovery room, Marcus Aldridge was sleeping off anesthesia with no knowledge that the person he was scheduled to meet in 7 hours was the reason he'd been shot. Claire looked at the tablet in Park's hands, at the name on the screen that connected Riverside Memorial Hospital and its 11 dead patients and its falsified records to something that operated at a scale she had not anticipated when she walked through those sliding doors 18 hours ago. And then her phone buzzed. She looked at it. A text from Damon Reyes sent 11 seconds ago. Aldridge is awake. He's asking for you. And Bennett, he says he knows who authorized the convoy ambush. He says he has proof. He says he's been carrying it for 3 days and he needs to give it to someone he trusts before his 9 a.m. meeting. He says it needs to be you. She took the stairs. It wasn't faster than the elevator at 3 in the morning, probably about the same, but she needed the 30 seconds of vertical motion and concrete walls to get her thinking straight before she walked into a room with a 2-star general who had just told her he was carrying proof of his own attempted assassination. Recovery was on the 5th floor south corridor. Reyes met her at the stairwell door and fell into step beside her without preamble. He's been awake for 40 minutes, Reyes said quietly. Alert, oriented, pain managed but not sedated. Surgical team says the repair was clean. Splenic laceration, controlled. He should be here 4 or 5 days minimum. Who knows he's awake? Floor nursing staff, the surgical attending, me. He paused. Not the 9 a.m. meeting. Does the 9 a.m. meeting know he survived the convoy? Reyes looked at her sideways. That's what I've been trying to determine for the last 2 hours. The recovery room had 2 soldiers outside the door. Not the hospital's security, not Roy Simmons with his radio and his practiced neutrality, but Reyes's people in uniform with the specific stillness of individuals who are not decorative. They stepped aside when Claire and Reyes approached. Inside, the room was dim. The monitors were running. A nurse Claire didn't recognize, night staff, 5th floor, was charting at the small desk near the window and looked up when they entered with the careful, professional expression of someone assessing whether this visit was authorized. Reyes nodded at her. She gathered her tablet and stepped out. Marcus Aldridge looked smaller in the bed than he had on the stretcher. That was usually how it worked. The physical authority that made people large in the world contracted in hospital beds, reduced by gowns and IV lines, and the particular vulnerability of lying down in a room that belonged to strangers. But his eyes, when they found Claire, were sharp and fully present in the way of someone who had decided that whatever the body was doing, the mind was not going to follow. "Bennett," he said. His voice was rougher than it had been in the ambulance bay. The intubation, probably, but steady. "General?" She pulled the chair to the bedside and sat, which was a conscious choice. People in authority talked differently to people who were standing. "Reyes said you have something." "I have more than something." He shifted slightly, carefully. 3 weeks ago, I received an encrypted transfer of financial documents from a source inside the Pentagon's Acquisition Oversight Division. The documents detailed a payment structure routed through a series of private entities, shell companies, nonprofit fronts, a hospital billing network in upstate New York. He watched her face when he said that last part. "Riverside Memorial," she said. "The billing fraud here was the laundry facility. Money from inflated defense contracts went in one end, came out the other as legitimate medical revenue. Clean, documented, auditable." He paused. "The man who built that structure, who connected the contractor to the hospital to the offshore accounts, his name is Philip Strand. He runs a defense logistics company called Strand Regal Group. He has 17 contracts with the Department of Defense currently active, totaling approximately $4 billion. The number landed in the quiet room with the weight that large numbers carry when they explain why people died. He was using the fraud to justify the contract payments, Claire said. Routing the overcharges back through the hospital made them look like legitimate operating expenses. And Voss got paid for access to the billing structure and for keeping the mortality records clean enough to avoid scrutiny. Aldridge's jaw tightened. 11 people died in this hospital because it was cheaper to reclassify their deaths than to have a live patient pursue litigation that might surface the financial structure underneath. Claire sat with that for a moment. She had known the shape of it since the stairwell. Hearing it stated completely by a man who had been shot trying to bring it down made it feel different in the way that confirmed truths feel different from suspected ones. Heavier, more specific, more demanding of an answer. "The proof," she said. "Where is it physically?" "Encrypted drive. It's been in the care of one of my aides since the convoy. The convoy was hit because Strand knew I was coming to Fort Carver to brief the base commander in the IG's office." He looked at her steadily. "He has sources inside Fort Carver, which is why I cannot give that drive to anyone connected to the base." "You want me to hold it?" "I want you to give it to Whitmore." He almost smiled, a faint compression at the corner of his mouth. Treasury DoD Joint Task Force investigating defense contractor fraud. No Fort Carver connection. And Whitmore was shot in a parking garage 2 miles from here, which tells me Strand's people know he's in the building but don't yet know he's still operational. "His surgery is in the morning," Claire said. "Then we have a window." She looked at Aldridge, at the IV running into his right arm, at the surgical dressing under his gown, at the monitors showing the steady mechanical accounting of a body doing the work of recovery. He had been shot, had lost significant blood volume, had survived emergency surgery, and was lying in a hospital bed at 3 a.m, trying to coordinate the transfer of federal evidence to outmaneuver a man who had already tried to kill him once tonight. "Where's your aide?" she asked. "Room 512. She checked in as a family visitor." Claire stood. She looked at Reyes. "Can you get Park up here in the next 15 minutes? "Already texted her," he said. He held up his phone. "I've been 3 steps ahead of this conversation since he woke up." She almost said something about that. She decided it could wait. Room 512 was 4 doors down, occupied by a young woman, early 30s, civilian clothes, with the contained alertness of someone who had been waiting in a state of high readiness for several hours, and was very good at appearing to simply be sitting. She looked at Claire, looked at Reyes, and produced a small encrypted drive from inside the lining of her jacket without being asked. "Aldridge sent you," she said. It wasn't a question. "Yes." She handed it over. Her hands were completely steady. Claire held the drive for a moment, smaller than a thumb, matte black, carrying whatever it needed to carry to end this. She closed her fingers around it and went back to Aldridge's room to wait for Park. Park arrived in 11 minutes, still in the same clothes she'd been wearing since Claire first saw her in the fourth-floor server room. She looked at the drive, looked at Aldridge, listened to a 60-second summary from Reyes, and then made 3 phone calls in rapid succession, each lasting under 2 minutes, each conducted in the specific clipped register of someone activating a prepared response plan. When she finished, she put her phone in her pocket and looked at the room. "Strand is at the Ashford Meridian Hotel," she said. "His security detail is 4 people, which means he's not expecting tonight to go wrong for him. He doesn't know Whitmore is operational, doesn't know Aldridge is talking, and doesn't know we have the server data from this building." She paused. "We have approximately 3 to 4 hours before his 9 a.m. meeting at Fort Carver, when the absence of the people he expects to silence will become apparent to him. I'd like to use those hours." "What do you need from this building?" Claire asked. "Whitmore needs to formally authorize the expanded warrant," Park said, "which means I need to talk to him tonight before surgery." "He can authorize from his room," Claire said. "I'll take you." She did. She took Park to Whitmore's room on the 4th floor, a private room that Reyes's people had arranged with the federal agent stationed outside, and stood in the doorway while Park spoke to Whitmore in the low, rapid tones of 2 people who had been working the same case from different angles and were now converging on the same hour. Whitmore, propped against 2 pillows with an IV in his arm and a hospital gown that he wore with the particular irritated dignity of a man unused to institutional clothing, listened and authorized and signed what Park put in front of him with a hand that was steadier than it had any right to be given what his body had been through. When Park left, Whitmore looked at Claire, who was still in the doorway. "Your brother," he said. "Yes. His name will be in every document we file, as a victim, as a named individual in the fraud scheme, it will be public record. Everything that was suppressed will be part of the court record." She looked at him. "I know. I'm sorry we didn't get here faster." "You're here now," she said. "Get some sleep before they take you to surgery." She went back downstairs. The department at 4 in the morning was as quiet as it got. 2 patients in the bays, the overnight nurse managing both, the particular late-hour hush that felt less like peace and more like the world holding its breath before the next thing. Claire sat at the nurse's station with a cup of Patricia's coffee that had long gone cold and wrote her incident documentation for the day with the thoroughness of someone who understood that paper trails mattered and that her own record was going to be scrutinized by people who would look for every gap. She wrote it all. The chest tube, the confrontation with Voss, the administrative complaint, the mass casualty response, her actions in Bay 6, her role in stabilizing Whitmore, the stairwell, the server room document, the medication printer, Sandra Chu's disclosure. She wrote it clearly and without embellishment, in the flat clinical language of someone who has nothing to hide and knows it. At 5:47, Damon Reyes sat down in the chair beside her. He had the look of a man who had been awake for 22 hours and had stopped noticing it somewhere around hour 15. "Strand was arrested at 5:19, he said. "At the hotel, went quietly." A pause. "His security detail didn't." "Anyone hurt?" "2 of Park's people. Minor. Nobody critical." He exhaled. "It's done, Bennett. The warrants are executing at Strand Regal Group's offices simultaneously. Fort Carver is conducting internal reviews of the personnel with contractor ties. Doyle is in federal custody and talking. Both Forsyth brothers are in federal custody. Sandra Chu's attorney contacted Park at 4 a.m. to formalize cooperation. He looked at the station, at her documentation, at the cold coffee. "It's done." She looked at what she'd written. 18 pages in 6 hours. "Voss?" she said. "Still upstairs. His attorney was notified at midnight. There will be charges: medical fraud, reckless endangerment, conspiracy. The mortality reclassifications are going to take longer to build criminally, but Park says the billing data makes the civil case essentially pre-decided." Reyes looked at her. "His license is gone. Park said the state medical board was notified at 2 a.m. and they'll move to emergency suspension by morning." She nodded. She thought about Voss in that corridor at 6:40 in the morning, and the smile he'd used, and the way the residents had shifted their weight. She thought about the way power operates when it's never been successfully questioned, how it mistakes the absence of resistance for the absence of capability, and how that mistake always, eventually, costs it everything. She had not come here to defeat Harlan Voss. She had come here because 11 people had died, and one of them was her brother, and the institution responsible had been allowed to keep running as if nothing had happened. Voss's collapse was consequential, but it was not the point. It was the mechanism by which the point got addressed. At 7:15, the day shift began arriving. She watched them come in, the nurses, the residents, the attendings, in the particular staggered way of morning shift change, some of them already in scrubs, some still in coats, all of them carrying the specific morning person energy of people who slept last night and did not know what had happened in their hospital while they were doing it. She watched their faces change as they got reports, as the word moved through the department in the way that institutional knowledge always moved. Not through official channels, but through the lateral current of people who work together telling each other what they know. She watched a resident stop in the middle of the corridor with a coffee cup half raised, listening to someone, and go still. She watched two nurses from the night shift sit down together in the break room and not say anything for a moment. At 8 o'clock, Patricia gave her morning report to the incoming charge nurse with the meticulous precision of someone who understood that what she put in that handoff would be documented. She included everything. She did not elide or soften. Claire heard her from the station, and something about the flatness and completeness of Patricia's report, the refusal to minimize what had happened in the department she'd worked in for 20 years, felt like its own kind of courage. Quieter than a chest tube at 2 in the morning. No less necessary. At 8:45, Sandra Chu was escorted from the building by 2 federal agents through the administrative entrance on the 2nd floor. Claire did not see it happen. She was in the bay with a patient, but Thomas told her afterward, and she noted it and returned to her chart. At 9:03, the hospital's board of directors convened an emergency session on the 6th-floor conference room. Claire knew because the overhead page asked all department heads to report to the conference room, and the list of names called did not include Harlan Voss. The board session lasted 90 minutes. At 10:40, the interim hospital administrator, a woman named Dr. Frances Okafor, who had been on the board's medical quality committee and who had apparently been on the phone with the state health department since 6 a.m., came down to the emergency department personally. She was in her 60s, compact, with natural gray hair and the particular energy of someone who has decided that the next 12 hours are going to require everything she has and is already deploying it. She stopped at the nurses' station and looked at the department, and then she looked at Claire. "You're Bennett," she said. "Yes. I've spent the last 3 hours reading your incident documentation, and Agent Park's preliminary report, and the security footage from yesterday." She paused. "Dr. Voss filed a formal complaint against you at approximately 4 p.m. yesterday. I'm formally voiding it. Every notation, every administrative mark, every record of that complaint is being removed from your file effective this morning." Claire looked at her. "Okay. I also want to offer you, on behalf of the board, pending proper restructuring, a senior clinical role in the redesigned emergency department. Whatever title and scope you want, you'd have full authority over trauma protocols." Dr. Okafor held her gaze. "I recognize that an offer made under these circumstances might not be something you want to consider today, but I wanted to make it while I was standing in front of you." Claire was quiet for a moment. Around her, the department continued. The monitors, the movement, the particular irreducible business of people needing help and other people providing it. She looked at the bay where Dale Pruitt had been, where the chest tube had finally gone in 13 minutes later than it should have. She looked at the east entrance where the ambulances had come in. She looked at the door to Bay 6. "I'll think about it," she said. It was the honest answer. She did not know yet what she was going to do. She knew what she had come here to do, and she had done it, and the thing after that was still forming, and she was not going to pretend otherwise to a woman who deserved a straight answer. Dr. Okafor nodded. "That's all I'm asking." At 11:30, Damon Reyes found her in the break room. The same break room where she'd eaten a gas station sandwich that morning and watched the department through the small window in the door. He sat down across from her with 2 cups of coffee that were at least hot, which was an improvement. "Whitmore's in surgery," he said. "Goes well. He'll be in recovery by 2. "It'll go well," she said. "You sound certain." The bullet missed everything important. The surgery is straightforward. She wrapped both hands around the cup. How's Aldridge? Improving, irritable, which the surgical team says is a good sign. He almost smiled. He wants to commend you formally. He said, and I'm quoting, "If Bennett is willing to accept a commendation from someone who technically has no jurisdiction over her, I'd like to give her one. Tell him I'll accept it if he eats his hospital food." Reyes actually laughed at that, a short, surprised sound that seemed to catch him off guard. It was the first time she'd heard him laugh in however many years it had been, and it sounded the same as she remembered. She looked at her coffee. She thought about her brother, about Jamie, who had been 29 when they admitted him to this hospital, who had been afraid of hospitals his whole life and had held her hand in the ER and told her it was going to be fine and had been right, up until he wasn't. She thought about the 11 names on the document from the stairwell landing. She thought about the families attached to those names, who had been paid for their silence with settlements structured to ensure they never found out what had actually happened. They were going to find out now. All of them. It was going to be hard and ugly, and the legal process was going to take years, and the money was not going to be enough, and it was never going to make the specific thing that was lost come back. But they were going to find out, and the record was going to say what actually happened, and the institution that allowed it was not going to be allowed to simply continue unchanged. That was not everything. It was not nothing. "Reyes," she said. "Yeah. Thank you for coming here." He looked at her across the table. "You needed backup." "I didn't know I did until the helicopters landed. That's usually how it works with you." He picked up his cup. "You operate solo until the situation requires you not to. Then you accept help for exactly as long as you need it, and not 1 second longer." She thought about that. "Is that a criticism?" "It's an observation." He set the cup down. "You're good at it, but you don't have to do everything alone." She looked at him. He meant it in the general sense. She could tell from the way he said it, carefully, as someone who has rehearsed an honest thing and is finally saying it. He was not wrong. He had not been wrong about her since Kost, where she had packed his wound with both hands and refused to let him die. And he had known her well enough since then to recognize that the things she refused to let happen were usually the things that mattered most to her. "I know," she said. "I'm working on it." He nodded. He didn't push it. That was one of the things she'd always valued about him. He knew when a conversation had reached the place where more words made it worse. They finished the coffee. They went back to work. The formal proceedings began 2 days later. The State Medical Board's emergency suspension of Harlan Voss's medical license was made public at 9 a.m. on Thursday morning, accompanied by a joint statement from the Treasury DoD Task Force and the State Attorney General's office announcing the arrest of Philip Strand, Leonard Forsyth, both Forsyth brothers, Marcus Doyle, and 2 Riverside Memorial administrators on charges that ran to 7 pages and included federal billing fraud, wire fraud, conspiracy to commit murder, attempted murder of a federal officer, and the charge that the press covered most extensively because it was the charge most people could understand, the deliberate manipulation of medical outcomes resulting in the deaths of 11 patients. The press conference was held outside the federal courthouse in Ashford. Claire watched the first 5 minutes of it on the break room television and then went to see about a patient who had been waiting 40 minutes for a medication review because the press conference was going to happen regardless of whether she watched it, and the patient was not going to see about themselves. The commendation ceremony was 3 weeks later. It was held in the hospital's main auditorium, a space Claire had never been in, which turned out to be larger than she'd expected, with rows of fixed seating and a small stage with a podium. She had been given minimal advance information about the format, which she'd interpreted as a mercy and which turned out to be accurate. There were representatives from the military, General Aldridge, who had been discharged from the hospital 8 days after surgery, and who stood at the podium with the careful ease of a man whose body was still reminding him of recent events, but who had decided not to let that be visible, and representatives from the Treasury DoD Task Force and the Interim Hospital Administration and the State Medical Board. Whitmore was there. He had his left arm in a sling and looked like someone who had discharged himself from his own recovery on a faster timeline than his surgical team recommended. Claire suspected this was true and chose not to say so. The auditorium was full. She had not anticipated that, had somehow imagined a small formal event, a controlled number of witnesses. But the seating was full, and the standing row at the back was full, and she recognized faces throughout. Damon Reyes in the fourth row, in dress uniform. Tomas near the aisle. Doctor. Adriana Reyes, not related, still amusing, 3 seats from the front. Roy Simmons in his security uniform near the door, which she thought was right and appropriate. The young combat medic with the dried blood on her forearms, who had handed Aldridge's care off to Claire in the parking lot, sitting with 3 other soldiers. The aide from room 512, who had produced the drive from the lining of her jacket without being asked. And in the second row, people Claire had called the night before the ceremony, because she had not told them what she was doing in Ashford, and she thought they deserved to know before they read it anywhere. Jamie's wife, Renata, who was 31 and had 2 children under 5, and who had accepted the settlement 3 months after Jamie's death because she had 2 children under 5 and no other income, and who had not been allowed to know what that settlement was buying. She was sitting with her hands folded in her lap, and when Claire found her face in the second row, Renata looked back at her with an expression that was not simple, was not just gratitude or grief or relief, but all of them at once, layered in the way that real emotions are layered when they've had 14 months to compound. Claire held her gaze for a moment. She nodded once. Renata pressed her lips together and nodded back. Aldridge spoke first, briefly and without performance. He laid out the facts of the investigation with the concision of a military briefing and the particular gravity of a man who understood that some things don't need rhetorical embellishment. He named the charges. He named the victims. He named Jamie. He said their names clearly and let the room hold them. Then he said Claire's name. He did not describe her as a hero, which she was grateful for because hero was a word that had been applied to her enough times in enough contexts that she had stopped being able to hear it clearly. He described what she had done, specifically, the chest tube, the mass casualty coordination, the preservation of evidence, the chain of decisions over 18 hours that had kept people alive and kept a case intact that might otherwise have been buried along with the records it depended on. He gave her the commendation with both hands, the way military commendations are given, and he said, quietly enough that it wasn't into the microphone, "Your brother would have been proud." She took the commendation. She looked at it for a moment, then she looked out at the auditorium. The staff of Riverside Memorial's emergency department were seated together toward the center of the room. She had worked with most of them for 3 weeks now, the weeks since the night of the investigation, during which the department had been restructured with Dr. Francis Okafor's particular brand of no-nonsense efficiency, and Patricia had been named interim charge of the entire nursing operation, and Dr. Kamau had taken on expanded attending responsibilities while the department hired to fill the gaps left by Doyle's absence and Voss's. They were not the same people she had walked in among on that first morning, not because they were different people, but because something had shifted in what they knew about where they worked and what it had been doing. When the room began to applaud, they stood. Not all at once. It wasn't choreographed, wasn't a synchronized gesture. It started in the middle of the room and moved outward like something true tends to move, and within 15 seconds the auditorium was standing, and the sound of it was more than she had prepared herself for. She stood at the podium and waited for it to quiet because she had something to say, and she was going to say it once, clearly, and she was not going to let the moment become something it wasn't. "I want to say something," she said when the room settled. "And I want to be honest about it, because I think this place has had enough of the other thing." She looked at the commendation in her hands. She looked at Renata in the second row. "I didn't come here to prove anyone wrong," she said. That's not what drove me here, and it's not what kept me here when it would have been easier to leave. I came here because my brother died in this building, and the record said it wasn't preventable, and I knew that was a lie, and I needed to see it corrected." She paused. "That's a personal reason. It's not noble. It's grief and anger, and the refusal to let something wrong keep being wrong just because it's been wrong long enough to look permanent." The room was quiet. "What I want people to take from this," she said, "is not the story about what one person did in one night in one emergency department. The story that matters is the 11 names Aldridge read at this podium. Those people came to a hospital because they needed help. That's a basic act of trust, the most basic one we make as human beings. The decision to put our lives in other people's hands and believe they'll hold them carefully. That trust was betrayed here, systematically, by people who understood exactly what they were doing and chose to keep doing it because it was profitable. She looked at the staff in the center of the room, at Patricia, at Tomas, at Adriana Reyes, who had come into that trauma bay without asking about hierarchy. Most of the people in this room did not do that, she said. Most of the people in this room showed up every day and did the work and tried to do it right, and that matters. And I don't want it to be lost in what happened to the institution around them. She stopped. But I also want to say, and this is the part that's harder, that doing the right thing in plain sight is not the same as doing the right thing when you can see that something is wrong. Those are two different decisions, and all of us, in all the places we work and live, are going to face the second one at some point. The question is what we do when we face it. She looked down at the commendation. She thought about the stairwell and the coffee, and Patricia appearing at her shoulder when she needed somewhere to stand. She thought about the chest tube and the delay, and the 19-year-old with the mild concussion whose mother had driven 2 hours and was still wearing her coat. She thought about Damon Reyes in a ditch outside Coast, and a headlamp, and a voice kept deliberately calm. I came here to save lives, she said. That's still why I'm here. That's the whole reason. She looked up. I hope it's enough of a reason for the rest of you too. She stepped back from the podium. The room stayed quiet for a moment. Not the silence of people who don't know how to respond, but the silence of people sitting with something they're not going to shake off when they walk out the door. Then Aldridge started clapping. Slow, deliberate, the kind of applause that functions as punctuation rather than noise. Then the room joined him, and this time nobody sat down. Afterward, in the corridor outside the auditorium, Renata found her before Claire had gotten 10 feet from the door. She was carrying both children, the older one on her hip, the younger in a carrier across her chest, and she looked like someone who had been holding herself together with considerable effort for a considerable time and had finally been given permission to stop. They stood in the corridor and Renata said, "He used to talk about you, you know, all the time. He said you were the most stubborn person he'd ever met." He was right, Claire said. He meant it as a compliment. Renata looked at her. He would have... She stopped. Started again. Thank you for not letting it stay buried. Claire looked at her, at the children, at the life that had kept going after the thing that happened in this building, the way lives always kept going even when something essential had been taken out of their center. He deserved better, Claire said. He deserved the truth. That's all I could give him. Renata nodded. She pressed her lips together. She was not going to cry in the corridor, and Claire could see her deciding that, and respected it completely. They stood together for another moment. Then Renata's older child said something urgent and incomprehensible and tugged at her collar, and Renata adjusted her grip and looked at Claire one more time. Will you stay? She asked. At the hospital? Claire looked back at the auditorium door. At the building around her, the floors above her where patients were in beds and nurses were taking vitals, and the irreducible work of medicine was continuing as it always continued, indifferent to investigations and commendations and the slow grind of institutional accountability. She thought about Dr. Okafor's offer, the senior clinical role, the authority over trauma protocols, the chance to build something in the place where something had been broken. She thought about the 11 names and the families behind them, and the work of making sure a department rebuilt itself into something that would not allow those 11 names to become 12. She thought about Jamie. Yeah, she said, I'm going to stay. Renata nodded like she'd known. She shifted the child on her hip and walked back toward the auditorium, and Claire watched her go and then turned in the other direction, toward the stairwell, toward the emergency department 4 floors below, toward the work that had never stopped needing doing. Damon Reyes fell into step beside her at the stairwell door. He didn't say anything. He walked with her down one flight, then stopped at the landing. He was needed elsewhere, she knew, other things pulling in other directions the way they always did. Bennett, he said. She looked back at him. For what it's worth, he said. I always knew who you were, even before Coast. You were never just a medic. He paused. You were never just a nurse. She thought about that. about all the ways a person gets reduced by the titles assigned to them, all the ways the world decides what someone is capable of based on what they're called, instead of what they've done. She had been underestimated in this building and in other buildings before it, and she suspected she would be underestimated in buildings after this one too, because that was not something that stopped happening once you'd proven it wrong once. But she had also learned, and this was the thing she was still learning, imperfectly, in the way that real things are learned, that the right response to being underestimated was not to spend your energy proving yourself to people who'd already decided. The right response was to go do the work and let the work say what it said. She had done that. She was going to keep doing it. "I know who I am," she said. "I don't need the title to prove it." She pushed through the stairwell door and went down to her department and got back to work, and the hospital went on around her doing what hospitals do, keeping people alive, one shift at a time, one patient at a time, one decision at a time. And that was enough. It was more than enough. It was everything.